In the United States, we currently assess, diagnose, and treat post-traumatic stress disorder through a narrow lens. This concept of PTSD is a narrow definition of trauma. A person must meet eligibility criteria to be considered deserving of trauma-specific intervention. Incident or event-driven conceptualizations of trauma are exclusionary. They set criterion-based formulations of trauma that exclude the most salient and standard features of trauma of most people accessing mental health services, especially in the public health domain. We must recognize that for most people, trauma is complex and needs long-term treatment by the provision of trans-theoretical frameworks. The toxic stress of historical and family traumas, the daily discrimination and microaggressions that marginalized people face causes traumatic injury, which is expressed as complex trauma. These are contributors and antecedents for that diagnosis, and they may be seen on the left side of this slide. We must recognize as practitioners that these ancient and historical traumas and atrocities create basic needs and life skills deficits for our patients, which must be addressed. And often these needs eclipse that of any single symptom definition or evidence-based practice. This slide shows the psychodynamic mutations of complex PTSD or the core symptoms of complex PTSD that are superimposed in or on the DSM criteria for PTSD. At the right of the slide is a model that shows how early life stress accumulates, eventually leading to multi-system involvement and early death for that individual. We can see that this problem set is overwhelming. The treatment is overwhelming. A trans-theoretical framework is needed to guide treatment of this entire problem set, and it must be set in a social justice lens. Only then can healing begin for the people that most need our services.